from all of you. For now, you'll be muted, and we kindly ask that you please refrain from sharing your video until we open it up for more questions. When we do open it up for questions, you can raise your hand or you could send me a message in the Zoom chat function. Food is everything when you think about it. Wise words from acclaimed DC area chef Jose Andres. 50 years ago, some, so others might eat, started handing out sandwiches and soup to our neighbors in need. While our programs have expanded to include additional services such as medical and dental care, mental health and addiction counseling, affordable housing and job training, access to food remains a critical component of our work. This morning, you'll hear from SOME President and CEO, Ralph Boyd, who joined us 10 months ago and early on in the pandemic. Ralph has ensured several critical service lines through the health pandemic, and as we see the light at the end of the tunnel with vaccinations, he is guiding us to meet the increasing needs of individuals and families. Thank you, Ralph.
Good morning. Thank you, Stephen.
For decades now, SOME has also partnered with Capital Area Food Bank, which has greatly enhanced our capacity to serve meals to the unhoused and expand food access to the recently housed tenants in SOME's housing portfolio. Also joining us this morning is Radha Muthaya, President and CEO of Capital Area Food Bank. Radha joined the food bank in April of 2018, nearly 3 years ago, and she has a very strong background in leading and growing new and established organizations through partnerships. She has served as CEO of the Global Alliance for Clean Cook Stoves and Vice President for Partnerships and Strategic Alliances for International Development Organization CARE. Welcome and thank you, Radha. We look forward to learning from you about partnerships.
Thank you for including me in the conversation.
Ralph, can you help us put things into context? Your office overlooks our historic dining room. What do you see happening outside, particularly in light of the ongoing health pandemic?
So what I see, Stephen, is what we always see here at our O Street premises is we see people congregating for food, among other things. And I'm happy to report, and you know this well, and as do many of our stakeholders and supporters and partners in the community, know that we've been able to continue our food assistance operations pretty robustly throughout the pandemic. We operate them differently where we need to, but we continue to operate them, and the demand for food is increased in almost every single one of our service lines, whether it's serving meals to go, meals that would have been formerly served inside our dining center facility, whether it's food being distributed from our food pantry warehouse here on O Street, or whether it's food being distributed through our various properties throughout the city for seniors and family and single adults who are recipients of our affordable housing with wraparound services. So what I see is a need that we always see in our community, but one that is ramped up and enhanced. And the one thing I would point out is what you would see in the people lining up for food to go. Typically, you know, our sweet spot is folks who are in the 0 to 30% of AMI, area mean income, the folks at the lowest level of the income tranche. But during the pandemic, demands on our food assistance programs, and I'm sure Radha has seen this through her work, in fact, she would see it in an amplified way, is the number of, not just the number of people, but the range of people and families who now need food assistance, many of whom were donators and volunteers themselves in the past, are now in need of the very services that they contributed to before. So what I see is what I've always seen, the urgent and exigent need of those at the lower rungs of the socioeconomic spectrum, those experiencing homelessness and poverty. But I also see folks who now need our food assistance, who are wage earners, earnest wage earners, and families even with dual incomes, who are now challenged by the economic fallout and consequences of the pandemic. So in some respects, it's business as usual, but amplified because the need is amplified during the course of the pandemic.
Thank you, Ralph, for helping to set the context. You know, Radha, how does this picture match up with what you see at Capital Area Food Bank and your 400 plus partnerships throughout the area?
Well, thank you, Stephen, and thank you, Ralph, for setting that context. We see something very similar, just at a heightened level, since we, as a Capital Area Food Bank, provide food across the entire Greater Washington area. So we provide food to all the counties in Northern Virginia, all 8 districts in Washington, D.C., as well as Prince George's and Montgomery County. We are, first of all, so thrilled to have had SOME as a partner, not just during this pandemic, but for over 30 years. SOME has been one of our oldest partners, reaching a critical set of constituents, if you will, to be able to provide them with food, as well as Ralph said, other wraparound services. So for us, we function more as an aggregator, a little bit behind the scenes, like a wholesaler, if you will. We're the ones that you know, purchase a lot of this food, as well as get it donated at scale. So to give you some perspective, we provided about 55 million meals worth of food in the last calendar year in 2020. That is about 23 million meals more than we provided in the year prior. So you can just see from those numbers, both the magnitude as well as the percentage increase. And this is sort of how our ecosystem works. You know, we're a little bit at the hub when it comes to food. We're the anchor provider and the leader of the food network, if you will, but we couldn't get food to those who need it without partners like SOME. And so SOME, as I said, is an incredibly important partner, one of our oldest partners, and one of about 400 partners in our network that help us reach and provide that distribution of food to those who are in need. The other thing I would say is that we have seen not just an increase in the number, but in a real diversity in the individuals who are in need. We recently completed a survey with our partners, and we saw that 44% of those who are coming to us or to our partners are first-time food insecure. And so this gets to Ralph's point earlier about so many of these individuals were making it paycheck to paycheck before, and maybe they had a month or 2 or 3 of savings, but 11 months, almost 12 into the pandemic, with high rates of unemployment, they're having to rely on the emergency food assistance network. So it's not just sort of typically who you think of, if you will, although there is no typical, I will say that, but there's just a lot more individuals who are first-time food insecure. And we track them, they're coming from every zip code in our region. There isn't a single zip code in which we don't have food insecurity at this point in time.
Wow, thank you, Radha. And I know Capital Area Food Bank had also launched these sort of hunger heat maps. Could you tell us about the areas where you're seeing, I mean, just drastic increases of food insecurity and how that matches up, sort of pre-pandemic?
Sure. No, and just to have your community understand a little bit, the hunger heat map is a map of the region that I just described, Northern Virginia, the district, Prince George's and Montgomery County. And what we do is we have several layers that are superimposed on that map. So we understand, we have a population layer, we have a food insecurity layer, we have food deserts. So how close are people to a full service grocery store? How close are they to transportation? So we've just map bus stops, metros, et cetera, because all of these factors help determine who is both most in need, but also the best channel to be able to get food to them, as well as just the right partners, and do we have the right number of partners across the region? So it helps us target clients who are most in need, but also understand what the landscape of that particular region or neighborhood might be to determine, is it best to have a distribution at the elementary school, or should we have it at the church that's close by, or is it less that people need free food, but it takes them 2 hours to get to a grocery store. So maybe we need to bring groceries that they're willing to pay for, but they just can't access. And so, those are the types of things that we have on the Hunger Heat Map. It's on our website. It's completely open source. We encourage all of our partners to use it because I think it helps us all be much more centered around our clients, the needs of our clients, and the best ways of reaching our clients. And we continue to add many different layers. So you can look at it from the perspective of, transportation. We're adding healthcare facilities. So you have a sense of how far different communities are from these healthcare facilities. So it's on our website. Feel free to go to that because it can be helpful in numerous ways. But to your point also, Stephen, we've seen a tremendous increase in food insecurity in 2 counties that will probably surprise many of us. It certainly surprised me. Fairfax and Montgomery counties are where we've seen the greatest increase in food insecurity. And again, traditionally, we think of those as the more wealthy suburbs, but even within those counties, we see tremendous inequity. So they're the very wealthy, but there are also those who are really struggling. And that, I think, has been another story of this pandemic. It's the exacerbation of inequities and the widening of that gap.
Stephen, if I can elaborate a little bit on some of the points that Radha made. One of the things a crisis does is it illuminates issues. It brings a certain amount of clarity and also an opportunity. And I think as Radha and I have begun to talk about what has been a historically robust partnership looks like going forward, I think we're both very concerned about how we more effectively and efficiently go to where the need is and meet the need where it is in the ways that we can deliver against that need most effectively and efficiently. So one of the areas that we've developed, and it's been strained during the pandemic, but I would look forward to us building this model out more, is our community markets, which for us are concentrated in Ward 7 and Ward 8. And it is a way to kind of take what we do with respect to distributing food on the road more, if you will. So what's happened during the pandemic is we've not simply relied on feeding people at our dining center facility on O Street or just distributing food from our food pantry at Hanover Place and O Street, but also distributing food through our various properties throughout the city, concentrated heavily in Ward 7 and 8, but beyond Ward 7 and 8. And then with the idea of building out this concept of community markets, going to where people are and meeting their food insecurity needs where they are, with a broader and increasingly broad range of healthy food products. And I know Radha's really pushed the healthy food thing with Capital Area Food Bank, getting fresh fruits and vegetables into places that are typically understood to be food deserts, so that people not only have food, but have healthy food that they can prepare, which of course impacts the health profiles for themselves and their families. The pandemic is brutal in many respects, but there are a lot of takeaways and learnings for us and opportunities to think differently about how we do what we do in this food assistance space.
Ralph, that's very helpful, putting it into even greater context of what's going on. So joining us, today are, 30, 40, interested people volunteering and contributing. So a question for both of you is, what could folks do to sort of help out with the increasing needs that both organizations are seeing? So Radha, any thoughts for those who are interested in helping?
Sure. I mean, you know, you're all already associated with a tremendous organization in SOME, and I'm sure that Ralph will talk about, you know, volunteering and additional support. We are open ourselves 7 days a week, and really do count on volunteers, because we're packing what we call COVID emergency boxes, and so those are nutritionally balanced food for a family of 4 for 3 or 4 days, and so we've got multiple shifts a day to facilitate the 14,000 boxes that we pack every week, some of which go over to SOME, you know, to be distributed. So I think continuing to have the support of volunteers is important. And I also think, as Ralph and I have discussed, I mean, what's so incredible about this partnership with SOME is that we both continue to innovate, and we do it in a very aligned manner. And that's important, because it's not enough for SOME to innovate and for us to stand still, or for us to innovate and for them to stand still. We're part of a seamless supply chain, or at least we want it to be seamless. And so the fact that we are, you know, in close collaboration is important, because, as Ralph has stated, you know, the pandemic, you know, however terrible, you know, it has highlighted different ways of working, and both of our organizations have pivoted in many ways. So we look forward to also having the support when it comes to the recovery out of the pandemic. I think what we've seen is tremendous generosity, which I'm sure both of us are very thankful for during the response phase. But as we move out of this into recovery and rebuilding, it's important to have our communities, you know, really be supporting more inclusive growth. And that can come in various ways, to help advocate for different policies, to continue to support with some of the innovations that Ralph talked about with the community markets and things like that. So I think there's not, you know, there are many different ways that the community can engage as we move forward.
Yeah, Stephen, and I would, one of the takeaways I hope we have from this webcast is for people to understand how much thinking and, as Radha said, alignment and innovation is going on, and how it's being done and intended to be done collaboratively going forward. For those who don't know, we're in the midst at SOME of a robust formulation of a new 5-year strategic plan. And when our 400 plus employees ask me what's on the table, I say literally everything's on the table. In a fully disrupted world, we've had to learn and will have to learn how to do things differently in some respects, and always to do it better in this kind of continuous improvement mode that we're in. But as we think about what innovation looks like for us, because of the relationship with the Capital Area Food Bank, and because of the forward thinking that Radha and her team are doing, we want to make sure that as we think about the food assistance part of our operations, we're thinking carefully about how Radha's team is doing it, so that we're aligned very well at best, and at worst, avoiding doing things that diminish our effectiveness and our efficiency. So everything from what our infrastructure looks like, our physical infrastructure, what our thoughts about what our distribution opportunities and resulting networks look like, that's all going to be on the table with us in our discussions going forward, so that we optimize the work of the Capital Area Food Bank, and they optimize our opportunities to actually get food in the hands of people who need it. With respect specifically to what people can do, it is many of the things that they've always done so well for us, so steadfastly and so consistently, both before the pandemic and certainly during the pandemic. We can always use people to volunteer to both serve those meals. We're not serving people inside our facility, but we've got a takeout service, a meals to go service that's humming at about 300,000 meals during the pandemic. So folks can help package those meals and have them be ready to go in a takeout format. You know, financial support is going to continue to be very important, especially as we innovate and as we build out our infrastructure. We're looking at a lot of opportunities to purchase and redevelop property adjacent to our area, so we can expand our food pantry operations. And so, you know, financial support is always a part of that. It's true for us. and I'm sure it's true for Radha's team as well. And then finally, it's also the donations of non-perishables is a big part of our supply chain. The Capital Area Food Bank supplies us. We make some purchases through other channels, and then there is the robust donor pipeline for us as well. So all of those things are things that people can do to support both our organizations during a time when we're both doing more, but also thinking about doing more and better for the future and what that looks like from an infrastructure perspective, from a human capital perspective, and from a operational perspective.
Thank you, Ralph and Radha. I'd like to open things up for some questions now, and I do see that we're getting a few already in the chat box, which is great. Folks can continue to type their questions into the chat box as they sort of think about them. As I suggested before, you could also raise your hand in Zoom. If you'd like to share your video when you're asking your question, we encourage that. It's always nice to see the people asking the questions, so thank you. Just a small reminder, make sure your camera is appointed appropriately, and you have a shirt and pants on. And as folks are gathering their questions, maybe just we could dive into a few of them that are posted here in the chat. Could you? I think this is for you, Ralph, about some of our varying locations throughout SOME, and can you tell us a little bit more about the 5-year plan?
Yeah, so we have different channels for getting food to where it needs to be. The initial one, the door to SOME that most people are most familiar with is our dining facility here on O Street at 71 O Street. It's where, when we, in non-pandemic times, we serve meals in our dining center. And it's also the place where we now serve the meals to go, the hot breakfast and the packaged lunches. We also have a food warehouse and food pantry across the street at 60 O Street. And that's the food pantry where we distribute packaged groceries to people who show up. And folks know that our target population, our sweet spot is the 0 to 30% of AMI, but we turn no one away from that food pantry. And as Radha underscored, the folks who are visiting our food pantry are a much more socioeconomically diverse population than we would have seen pre-pandemic. We also provide food assistance to those between 1,000 and 1,500 people who live in our affordable housing units. We own over 40 and operate over 40 properties around the city. So during the course of the pandemic, that's the part of our food distribution pipeline that's really ramped up as well. The amount of food that we're channeling to single adults, to families, and to seniors through our family and adult services programs in those affordable housing properties. So that's another way that we get food and meals to people. And then finally, I made reference to our community markets, which is a robust part of our partnership with the Capital Area Food Bank. Those have been diminished somewhat during COVID, because that's where we distribute a lot of the fresh fruits and vegetables in properties and markets in wards 7 and 8. And because of guidelines around the handling of food, that's challenged in this context, but it's something that going forward, I think will be a real priority for us, because it gets us out into the communities where the need is most urgent, but also it gets the kind of healthy food in the hands of people in a way that we want to, so that folks are not only eating well, but they're eating in ways that will advance they and their family's health profile. So those are the different channels through which we provide food assistance. And as I said, they're all up and cooking in an accelerated way, except for the community markets during the pandemic.
Thank you, Ralph. And Radha, what do you see, you know, sort of coming out? You had sort of touched on this a little bit earlier, you know, the rebuilding with a protracted economic impacts of the virus. You know, how do you see food delivery systems, you know, fundamentally changing or adapting to reach, you know, more communities of people in need? And what role is both Capital Area Food Bank and can SOME, you know, have in this, you know, on top of, you know, some of the things Ralph was just mentioning around the pantry services and delivery of food, you know, to seniors, families in need?
Right. No, it's a great question. So as a Capital Area Food Bank, we're focused in two different directions. So one big one, our core mission, you know, why we were founded is to provide food to those who are hungry today, right? And that's what we've been spending so much time talking about in terms of the increase in the numbers of people who need that food assistance. An equally important part of what we're focused on is how food can enable these pathways towards brighter, more sustainable futures. So we use a tagline about, you know, good food today, you know, and brighter futures tomorrow. And here, what we're looking at is how do we bundle food with other basic support services that we know our clients need. So that could be, you know, a client who's a pregnant woman but doesn't have access to good health care. Could we bundle, you know, food that is appropriate for her during her pregnancy and have that be distributed, for example, at a clinic when she goes for her prenatal checks? So that way she's getting two support services at the same time. And food could be that incentive that actually gets her to the prenatal clinic. So I think it's interesting. Ralph has talked about dentistry and some of the work that SOME is doing there. This is an interesting way that we could collaborate as well in terms of, you know, is food that draw, you know, that will bring people to get, you know, other necessary services as well. We're partnering with different educational institutions, whether that's K through 12 or college now, because there's a high degree of food insecurity amongst college students as well. Again, can food be that incentive that draws people to a workforce development or a certification program? And the fact that food will be provided every week or every other week, will that keep them in the program so that they can graduate and with those skills get a living wage job as opposed to what they might have had, which is an intermittent minimum wage job? So I mentioned these examples because they're ways of helping people out of the very challenging circumstances that the pandemic has put them in. And we hope for a recovery that doesn't just bring them back to a minimum wage job, but actually one that facilitates a living wage job. So as Ralph has talked about AMI, we're hoping that those who may have been in the 0 to 30 can now actually find themselves in a much higher, you know, level of average mean income in our area. So we're focused on these food plus, we call them, initiatives. And to be honest, the food bank is not going to start offering workforce certification and you know, healthcare. That's where we really rely on our partners, like SOME that, you know, might have the dentistry, you know, aspect to their work, has affordable housing. So we could think about getting more food, you know, to those who are there. So we're looking for partners, different community colleges, et cetera. What we bring is the food. And we think when it's bundled together, that will create this pathway for our mutual clients to be able to go from the state of dependency and additional support that they find themselves in today to a point of greater sustainability where hopefully they don't need either one of our organizations in the future. So that's how we're thinking about the recovery and the rebuilding.
Stephen, I love the question, and Radha's answer excites me even more because I hope one of the things that people take away from this webcast is how aligned we are in our thinking in terms of how we see ourselves operating in the world we're in right now. And I think if I were to distill it at 100,000 feet, I'd say that that Radha shop and SOME are involved in the saving life business and then the transforming life business, taking people holistically from a position of extreme need to a place of sufficiency, and then ideally to a place of prosperity, whether it's material, whether it's health and wellness, whether it's spiritual, emotional. That's the business we're in. And we have a lot of tools to help people get there. and food is one of the food bundled with services. When I hear Radha say that, I almost come out of my seat with excitement, because that's exactly how we see it. So many people's first introduction to SOME is through food. It's through our dining center. And we view that as the first door to open all the other doors of things that we do for people. So you mentioned earlier strategic planning, and I think I mentioned that we're in the midst of this 5-year strategic plan. And so we're in the conversation and the harvesting of ideas phase is how I describe it. But some of the themes I'm hearing from our teams are these notions of integration and alignment. And one of the concepts that's arisen is building this capacity to have a concierge case management system, if you will. So when someone comes in the food door, this concierge model informs them of and connects them with all the other services they might need. So if it's medical services, dental, behavioral health, addiction treatment, job training, academic enrichment, all of these other services that we provide, the food door that people first walk through can be the entree to all these other services. So, it doesn't matter to us what door you walk through, but it's very clear that the first introduction that many people have to SOME is through that food door. And it's been that way for 50 years since Father McKenna and some pastors were handing out those sandwiches from the back of a country squire station wagon.
Thanks, Ralph. A question coming through the chat. What are the needs for prepared food versus general groceries? Are we seeing, particularly, I imagine with the unhoused, just to expand a little bit, more of it is prepared food, but also factoring in, downtown DC, if anybody's been there recently, we're seeing restaurant after restaurant, either closing or limited hours. Could either of you, maybe Radha, start with you, sort of the distinguishing needs between prepared food and general groceries?
Sure. No, it's a very good question. So we look at our clients and break them out into different client segments, if you will. So for those who we know are in need of prepared meals and who we are trying to serve in one way or another, clearly the houseless, and you all are the experts there. So I'll have Ralph talk about that. For us, we see two other segments of the population that really do require prepared meals in a much more significant way. One is this sort of college age population, as I mentioned. Some of them are, a term that I learned that they use is couch surfing. So they don't necessarily have homes because it's just expensive if you're going to school in this area, to on top of tuition to be able to afford housing. So they live in their cars, they live on different people's couches, etc. So basically they don't have access to a kitchen all the time. And so for them, the grab and go and the prepared meals are just as important as having some groceries. So that's a segment that we're very focused on. The other segment is a broad segment of seniors, and we're in the process of sort of breaking down that segment into 3 different segments. So there's seniors who might be seniors in age only, they're over 60 or 62, whatever the cutoff is that we use, but they're they're just as vibrant as a 25-year-old, and so for them, it doesn't matter whether it's prepared meals or groceries. They might like to cook, they might not, and so they might get a combination of both. But then you've got a second segment, which is a little bit more, I would say, mobility constrained in one way or another. So physically, maybe not being able to go to the grocery store, but also even if they can, maybe arthritis is more of an issue and they can't cut, a big cantaloupe, a watermelon, a cabbage, a cauliflower. And so for them, we're starting to not necessarily have prepared meals, but sort of pre-cut, if you will. So it's easier for them to do their cooking. And then there's the third segment of seniors, which those who really are more constrained in one way or another and have limited mobility. And for them, yes, it's either prepared and frozen or, something that they can have at room temperature and eat. So that's how we're looking at the different groups that we're focusing on. But I'll turn it to Ralph, because I know you have a lot more expertise in this area.
So I would, thank you, Radha. I would give folks a few data points that I think illuminate what we're seeing and what we're doing in the current context, and maybe give us some sense of what we'll see going forward. So as I think you know, Stephen, but not everyone would, we're serving about 800 prepared meals a day during the pandemic. That is the hot breakfast and the packaged lunches on a to-go basis. During the periods, the non-pandemic periods, when we're serving meals in our dining center, it's actually much more than that. So we're serving fewer prepared meals each day at our dining center facility. And the reason for that is simply when we're able to feed people inside our facility, there is shuttle, van, and bus service between the various shelters and pickup points throughout the city. Those have not been running during the pandemic. So the people that we're serving are basically walk-up folks. So it's still 800 meals a day, but it's less than it would be in during a normal period of time. Where the incredible surge and uptick in demand for food assistance with us is through our pantry and through the distribution to our various properties. To give you some sense of that, the food we would normally distribute to our affordable housing properties is in a typical time period would be 32,000 pounds. And during the pandemic, it's almost tripled. And so we're getting a lot more demand and a lot more food out through that network. And then the demand on our food pantry has been essentially about a 5 multiple during the pandemic. So 500% increase in demand on our pantry. Happy to say that we've been able to meet that increased demand and measure, because of both our stakeholders, our donors, and our partners, of which the Capital Area Food Bank is probably the longest and most steadfast and significant of our partners. So we've been able to meet that increased demand from a much more diverse population than before. And we've been able to meet the demand for folks living in our affordable properties. And then we've sustained the prepared meals on a slightly smaller scale than we would normally provide for under normal circumstances.
Thank you, Ralph, and thank you, Radha. This next question sort of reminds me of a story that I recently heard in New Jersey of a young girl who's in a virtual classroom, and when her teacher calls on her, she breaks down into tears and confesses to her entire classroom how she's starving at home. Her mother lost her job in March in the food service industry, was struggling in making things neat. I can only imagine this has been going on for some time. Thankfully, with the help of her school, they were able to get some support in for this family. But, and interestingly, I know in many locations in DC and in various states, schools are continuing to provide, meals for families despite their challenges in opening up for full populations, during the pandemic. For both of the organizations, when we're seeing increased need, first time, food insecure families, how do they know to come to SOME or Capital Area Food Bank? Could you talk a little bit about some of the outreach to communities and how to make sure that all of us, as we're seeing increased needs, are being able to direct people in the right way?
You want to point a direction first, or do I defer to Radha, since she's more succinct than I am?
Whichever one. Yeah. Ralph,
Radha, if you want to, I'm happy to have you go first, or why don't I take that? I got the or, why don't I take it? So our outreach, and one of the reasons you see the the tremendous uptick in the amount of food that we're distributing through our single adult and family and senior services programs is because we do have those comprehensive wraparound services for residents of our affordable housing properties. So those services are a great outreach vehicle for us because we're not just tending to folks' food needs, we're looking at the whole person and assessing what all their needs are. So that's a readily available channel for us to get the message out about what's available to support people from a food assistance perspective through SOME. As I hope many people know, we also have many partners, and the fact that Radha's on this call with me underscores that. And I think one of the points I'd like people to walk away from is that Radha and I are in the service business, and we're not turfy about it. Our job is to get food to people who need it in a way that they can access as efficiently and as expeditiously as possible. And in order to do that very well requires alignment, coordination, collaboration. So for me, quite honestly, while I want us to be really good at this, to optimize it, to be as operationally effective as we can be, and to be as smart as we can be in our conceptualizing about how best to do it, I understand that if other people are doing it well too, and we can help them succeed at that, then we're advancing our mission, whether it's us doing it directly or whether it's us providing support and publicizing, if you will, what other folks are doing. So when you're in the life-saving and transforming business, you own the outcomes of everyone who's in that space. And you kind of view it as your responsibility, not just to optimize what you're doing, but where you can to facilitate and optimize others. So part of it is working with other people, knowing what their capacity is, knowing what they're doing, and talking about it and sharing that information broadly amongst the population that needs to know it.
That's right. I mean, it's a perfect segue for me to talk a little bit about how, if we rewind back to middle of March last year, which we're coming up on a year now of COVID, what immediately happened was we got contacted by media first, in the sense of where should people go? Where do they need to go to get food? And what we noticed was, I mentioned earlier, we have 400 plus partners usually in our network. Those first few weeks of the pandemic, it completely crumbled the network. It was down to literally 50 to 60 organizations that stayed open because people were uncertain, as you recall, should I go to work? Should I not? Should I take public transport, etc.? So it immediately crumbled at the time when demand was starting to go up. And so what we did is we called our partners to say, are you open? What's your capacity? Do you have reduced hours? And this is how we collaborate, because as Ralph has mentioned, and I mentioned earlier, it is not enough for the Capital Area Food Bank to say, oh, yep, we're buying all this. We've got 770 truckloads of food that are coming in, if we don't have a good understanding of who's able to distribute that, in what manner, with what capacity and which days. So on our hunger heat map, we had a special heat map that was, and it's still on the website, where daily we were updating it with who's open, what hours, in which neighborhood. And then that was helpful for us to be able to get food out to those partners who are open, but also for others who are then going to the website to see where they should go if their typical pantry was closed, and so where would they go to, to be able to get food? So that's one way I think that we, engaged to get the word out, and the media was very helpful there. The other way I think that we both do is, we live within an ecosystem that includes our local governments as well. And many people will turn to them. The mayor, obviously, in DC had many different press conferences at the time, and others. And we just, essentially drew out a map for them to be able to use to highlight in their communication, through newsletters and press releases, exactly where people could go. And we kept updating that as well. The third and last point that I would make is how you started the question, Stephen, with schools. And this is obviously, it's very hard to accept any type of hunger. It's just so hard to accept childhood hunger. And so one area, and we provide food to almost all the elementary and middle schools in the area through what we used to call a family market. So a whole family can come pick up, 30, 40 pounds of groceries each month and go home. And typically it's in an elementary school because most people can walk to their elementary school. And so transportation isn't a burden. The challenge, of course, with the schools being closed is, where do you provide this and how do you get it? And there again, I think it's partnership with the governments, with others to be able to distribute both the after school meal in a grab and go form, but also some of these groceries that families had come to depend on. So I think, to Ralph's point, it's all about bringing all of your information to the table, not being shy to share it, because we're part of the same ecosystem. We all pivot to play different roles when in some way, in some cases during an emergency. But the importance is to ensure that we're all streamlined, because the end outcome is what we care about, less about the individual role that each of us is playing.
Well, thank you, Radha. That's very helpful. Reminder to everybody again, raise your hands, send the question in through the chat. I think we have about 10 minutes until we're at the end of the hour, so please feel free. Well, one other question that sort of comes up is, outside of the outreach, and sort of looking ahead towards the future, what conversations are both organizations having with the respective government agencies and outlets that take on different roles depending on the actual jurisdictions, but certainly guide and coordinate a lot of the work, going forward. Earlier, both of you had talked about integrating and complementing services, both within organizations, but also externally. What role does sort of DC government and respective agencies in Maryland and Virginia play with a lot of this? Radha, I know you've been having a few conversations sort of looking outside of the district, and you just referenced some of the discussions with the mayor's office.
Sure. Yeah, happy to take that. I think, what we've all learned from this, and even if I were to say prior to this huge pandemic, even the federal government shutdown that occurred a couple of years ago that happened right around the holidays and through January, is that our region, whether we like it or not, will likely face a series of exogenous shocks, if I can put it that way, going into the future. So we should start to really develop a resilience sort of framework so that we can anticipate and know how we need to coordinate and work together in the face of whatever that next shock might be. And I think this pandemic is certainly, the biggest shock of all in the last 100 years. So it's put us all to the test, but we have many learnings coming out of this, as you heard Ralph speaking to earlier as well. And so it's putting all of that into, a resilience framework that helps us withstand these shocks in the future. And we've certainly been engaging with many partner organizations as well as the governments to say, let's not forget all of this as soon as we are all vaccinated and we're back to our jobs. We need to think about everything that worked here and make sure that we're able to turn that on a dime should when the next shock hits. So I think that's one. I think the other is that there's so much attention when you're in the moment of an emergency. What Ralph and I have talked about as well, and we know it's going to take years for this high number of food insecure, and I'm not sure if I mentioned it earlier, but we've gone in our region from 400,000 food insecure to close to 600,000 people who are food insecure just in the last 11 months. That will not drop back down to 400,000 in the next 12 months. It will take many years for people to become a part of the growth that will return to this region and be a little bit more sustainable. So I think we should also be cautious and not think that as we get vaccines in arms, that everything is back to normal again. It will take some time. And so whether that's private support or consistent government support to enable the right policies, et cetera, to facilitate more money in people's pockets and more food, flowing to them. All of those things are important. So as part of our advocacy, we're continuing to talk about things like the Earned Income Tax Credit and the expansion of SNAP, the expansion of WIC, the Women and Infants and Children program. All of these safety net measures shouldn't just disappear, at this summer, but they need to stay for some time to come.
And Stephen, I would want to take us too far afield from food, but I think my response to your question and following Radha's comments underscore the connectivity of all of this in our food ecosystem. And I would say that one of the issues that exacerbates, one of the things that's both an exogenous and indigenous shock is housing displacement. And the fact that we continue in Washington, D.C. and in the broader national capital region, and we are not any different from other major American metropolitan areas in this respect, but we continue to chase the game on affordable housing. And with displacement of people, with the experience of homelessness, it exacerbates all of these other issues, food insecurity prominent among them. And so for us, part of the response to the need for greater food assistance is to get more and more people housed in affordable units. So in addition to our focus on being able to provide more food assistance in more efficient and effective ways going forward, a big part of that for us, quite frankly, and you've heard me talk about this, is to get more affordable housing units built. So my work with government, I've recently gone on Mayor Bowser's rental housing strike force. She calls it a strike force. And the idea here is across market segments, what do we have to do to get more people effectively housed? And a big piece of that focus is the affordable market. And within that affordable market with supportive services for the most economically vulnerable people. And so for me, what I care about a lot going forward from the government is I want to make sure that the District of Columbia government keeps those 4% and 9% low-income housing tax credits flowing, because they're a critical part of the financing stack that we use to develop and redevelop affordable housing units. I want to make sure they continue to capitalize the Housing Production Trust Fund and the Housing Preservation Trust Fund, so that we can continue to build more units and rehabilitate more units, preserve more units, and house people with that full range of comprehensive services and deal with their food insecurity issues. And so for me, all of this is knitted together. I can't separate the food issue from the housing issue, from the healthcare issue, from the mental health issues. All of this is knitted together in a pretty inextricable way. So as we go forward and look to build more units of affordable housing, we also look to put capital towards an infrastructure that will help us to get more food to more people in more efficient and effective ways. And that's the conversation Radha and I are going to be having going forward, as she looks strategically and tactically at what they're doing in a very analytical way. If it isn't obvious to people that Radha's thinking and her team's thinking is incredibly analytical in this context, it is, and I want to have us grow in that space with them in a way so that we're aligned and amplifying what each other are trying to do, and reminding folks of what Radha This is simply saying we're an ecosystem and we're a part of it, but we're certainly not the only parts. And to the extent that we can be in the boat, rowing in the same direction, with the same beat, really ups the ante for us in terms of being able to deliver more and better for the people who need it.
Thank you, Ralph. That's really very important on the housing side. We do have one more quick question and then I'll probably wrap things up. Increases on food prices, particularly at the start of the pandemic, how has this sort of impacted both the demand and similarly distribution sources for food? Radha, you probably experienced a great deal of this early on. Perhaps
Sure.
Start with you.
Sure. You know, it's I'll throw out a couple of figures that I think might tell the story of the increase in food prices since the beginning of the pandemic. In a typical year, the food bank gets about 2/3 of its food donated to us from retailers, area retailers, and we, you know, sort of on donate, if you will, to our partners. And then we get some from the government, from USDA, and about 20% is purchased. Of that 20% that's purchased, we usually spend about $3.5 million out of our budget to purchase that food. Last year, we spent over $20 million on purchasing food. This was due to the fact that retail donations just dropped. I mean, all of you will remember there was no food on the shelves for the first few months. So there was nothing for retailers to donate to us and to our partner network. So we had to purchase it. But in addition to the increase in quantity that we were purchasing, we look at, we're a wholesale purchaser. So we look at truckloads of tuna and peanut butter, et cetera. Never, ever have I been so focused on the price on the wholesale market, of these items. And tuna in particular, protein is something that we know is expensive for people to buy. And so they look to get that from the food distribution network. If, they can manage their carbohydrates, et cetera, purchase. So we just saw those prices triple, because there was such scarcity, not just in the item tuna, but in the aluminum cans, that were coming from China, and those were delayed. And so whatever was available here was sky high in terms of prices. So I won't go deeper than that into the nitty gritty, but just to give you some perspective on how things changed so dramatically, both because of volume, but also because of the cost of all the materials that, have to come together for a unit of food.
Yeah.
I would just say, Stephen, I would add to that by just simply saying we had to broaden our sourcing base. We had to purchase more than we typically would. Those are the two tough messages. The good message is that our stakeholders understood this either specifically or more generally, and allowed us to be able to do it. So the bad news is there were far greater demands on our resources. The good news is we were able to meet that increased demand because our stakeholders got it. They understood it, they got it, and they responded. And so we're grateful for that, and of course grateful to Radha and the Capital Area Food Bank, and grateful for not only what they've done with us for the last 30 years, but what hopefully they'll do with us for the next 30.
Thanks, Ralph. That's a great note to end on. We are now at the end of the hour. So let me just say this is the start of a conversation, an ongoing conversation for our organizations and with our many supporters throughout the area. If there was something that interests you, if you have any questions, please feel free to reach out to me directly. My phone number 202-350-9199. Also, my trusted colleague and dear friend, Melanie Mins, is over at Capital Area Food Bank. If you'd like to learn more about them or have any questions on this call, you could reach out to Melanie. Her number is 202-644-9856. With that, I will wish everybody a great day. Stay tuned because on April 14th, we will have our next community conversation at SOME, this on the topic of faith. What does it mean to be part of an interfaith organization? How does faith guide our staff, volunteers, investors, and clients. We look forward to that conversation in April. And in the meantime, please stay in touch. And thank you, Ralph. Thank you, Radha. And thank you, everybody, for joining us this morning.
Thanks, Radha. Thank you, Stephen.